Hi, I'm Alan. I've been coming to Theatre Nemo for about 7.5, maybe nearly 8 years. I'd say give it a shot, and if you feel nervous the first time, don't give up, keep coming back, because it does get easier. The social aspect, that is. And there's always going to be, nothing's perfect, there's always going to be situations where something doesn't happen, you fall out with someone. But that happens everywhere you go. But at least within Theatre Nemo we have an understanding of each other.
Mental health is beginning to be spoken about, which is the first step in it becoming recognised as an issue as real and integral as physical health. As mental health is brought to the fore, I hope so are the different avenues someone can take to get help that exist out there. Not just aim to treat, but to support, recognise, and respond to the needs of someone with a mental health condition. I spent some time with Theatre Nemo, a community project based in Glasgow that is doing just that.
I'm Isabel McHugh. I'm the founder and the chair of Theatre Nemo, which is a charity theatre company, and the whole purpose is to look at how the creative arts can help people who have mental health issues.
Well, my name is Kwan, and I've been here in Theatre Nemo for nearly more than 3 years. I want to say a bit more. It's just not fair out to find the hardest things to say when you're out and about with people, but when it comes to in doing a performance, you won't have any problems with that because it's been scripted.
Practicing for 4 more. Top of his class. If you have an illness, an ailment, a disease, an injury, then Dr. Alex Monroe, GP, will meet you, diagnose you, prescribe the right drugs, and send you on your way in 10 minutes. It has to be 10 minutes.
The importance of the doctor is, I think, to prove that really GPs don't have enough time to diagnose people with have a mental health problem. And if you have a good GP, it can make a heck of a difference, which I know in my own experience. And that is shown very well in the play when Tim, aka Robert, does his scene with the voices, etc. And it's very poignant for a lot of us because, for example, I myself have had these voices, so I know how important it is to portray to the audience just how it really can be.
Right, well, I'm Dr. Susan Lennox. I'm a general practitioner in Ayrshire. Most GPs will work to 10-minute appointments, and you'll have in the order of 14 to 16 patients to see in a surgery setting. So a patient will just book a 10-minute appointment and come in with whatever their issue is of that day. If it's pertaining to their mental ill health, it can sometimes take that 10 minutes to really work that out. As I say, I can only speak from a GP perspective. The GP is one route, but it's only one route, and it's a very limited route. But the structure that we have of a health service and the society that we have, there is very much, I see, an expectation that if you have any mental health concern, then the only route you can go is to the GP. I'm not saying you shouldn't go to the GP, but I don't think it's the only route. And I don't think the GP need to take that on as being the only route. And therefore, if, coming back to the creative arts, if there was more provision or more awareness for GPs of how they could access other routes, I'm sure they would use it.
Nothing. I don't have a clue. I don't know.
Medication.
Medication?
Yeah. I'm not sure.
Not sure.
Therapies, analysis, that sort of stuff.
Probably limited resources, and what's out there is probably oversubscribed.
On a sort of wider subject of the role of Theatre Nemo and other sort of creative projects like it, I see that very much instrumental in bringing the whole subject of mental health and or ill health to the fore, because the greater the awareness out there, the less stigma that will come, and the less stigma will make it easier for people to come forward and seek the help.
Often we make the mistake of thinking that the only services for mental health that exist are the ones most represented in the media. Sadly, the reason they are so represented is negative. This can be really damaging. It can stop people from getting help as soon as they come forward. It can stop people coming forward at all. Community projects like Theatre Nemo offer accessible, relatable and approachable help for people with mental ill health, other than just the medical route we are so prone to think of. Making the choice to fight is hard. Having chosen to do so is the first hurdle, and people deserve a response straight away. Community projects could be that response, but people don't really know about them.
There's something really special about people bringing out their creativity.
Well, for me, it's always kind of been very important that art doesn't just entertain, and it's not just for the artist, so to say, but that it has a greater purpose, and that it is helping those that suffer.
It's so different from everything else, like the medication and the other kind of therapies. It's something that they take upon themselves, and they then think how they can change their lives.
See, perhaps police custody is not a suitable environment for someone with a mental illness. I'm not saying that it is, and I'm not trying to criminalise behaviour of the mentally ill, but I just don't know what to do. I've read all the things I've been given, what to look out for, but really, we just don't know what to do.
I'm Rosie Wright, and I work just now at the Divisional Policing Team. I'm based at London Road in Glasgow. We are a national team who look at corporate practices across Scotland, identifying and sharing good practice and trying to make things better for everyone who works in the organisation. From a very young service for me, like being a young frontline officer, almost back to my days in my probation, when I first joined the police, it always struck me that we dealt with some things really, really well, and there were some areas of policing our communities that we could do better. And one of those areas we're dealing with people in distress within the communities that we're working in. And it used to really frustrate me when I was sent along to a call or an incident where a member of the public was in distress, displaying concerning behaviours, perhaps threatening to harm themselves or harm others. I maybe thought in my limited knowledge and experience then that they were mentally ill. And the procedure then, if that person hadn't committed an offence, would be to take them to a hospital as a place of safety, where they would then be seen by a crisis team, mental health CPNs. Generally speaking, it was an accident and emergency department where I could be left in the waiting room with that individual and my colleague, obviously, for a very long period of time, anywhere from 2 hours to perhaps my entire shift. And very often that frustration was added to because I was having to sit and chat to the person, try and make them feel better, but not knowing if anything that I was saying was actually adding to their distress and situation.
Isabel, who works with Theatre Nemo, obviously started the company, says when she went out and spoke to many policemen that was sort of all the feedback they would get, that it's just they don't know what to do themselves and they're just doing their jobs. They don't really have many other options. So we're just trying to make that clear to the audience.
I heard about a model of street triage in Cleveland, which was again a funded scheme from the government, which was 3 CPNs working dedicated to the Cleveland Constabulary and working in out of our service and responding to calls. Very quickly we then got in touch with the Greater Glasgow out of our psychiatric emergency service, which was an existing service big team of nurses, about 27 or 28 nurses, all working on an out of hours basis. And they were there at their work anyway. We were here as police officers at our work anyway, so it didn't need any extra money or funding. The operating hours are between Monday to Friday. It starts at 8 o'clock at night until 9 o'clock the following morning. And on a Saturday and a Sunday, it's 5 o'clock at night until 9 o'clock the following morning as well too. How the service works. There is a person in distress or apparently suffering from a mental illness or disorder, and the police officer thinks that they need that care, then they all know the telephone number for the service. They have the telephone number. They'll phone the service from the scene, and there is always a call taker ready to answer the phone at the other side, at the NHS side. And the call taker will ask the police officer some questions, and they will then say, right, that's fine, we'll go and check our records to see whether this individual is known to services or not. They very often are. And we'll get a member of the team to call you back very, very soon. And on the vast majority of occasions, these incidents are being resolved over the phone. Now, even with the increased awareness and increased use of the service since January, our colleagues in the NHS are still responding within an hour on 90% of these occasions, which is really quite outstanding service delivery times.
Theatre Nemo works by allowing service users to explore through creative techniques issues that affect them in their daily lives. It also gives a fantastic platform to discover which areas of mental health care need reform through the lived experience of those they affect and how those needs are being answered. Like Rosie Wright's inspiring work with Glasgow Out of Hours Community Triage Team, which has answered for both the lack of support for police officers and for people in crisis with a mental health issue.
Like, I think at the beginning what I had to learn was that this was a topic that we can talk about. You are allowed to talk about mental health illnesses or being lonely or, you know, I've had a crap week this week, and not necessarily, like, I feel like society always kind of shoves it underneath the carpet, and here we're able to talk about it and bring it in the open and still, like, be authentic and laugh and still have a good time and not necessarily sit here and be like, well, I'm really sad now, so I'm not going to have any fun, you know? So.
These are dangerous people. We have to stop them, he said.
I think to make me feel more confident in myself. I mean, I'm never going to be totally like socially confident because I don't consider myself a very extrovert person, and I might never will be, but I'm confident when it comes to my talents and doing groups, which might be sometimes become a little bit narcissistic of me, but I try not to, because I mean, you don't often get places where you can show your talents if you're out and about anywhere. So that makes you feel good about yourself when you can actually show talents and also use it towards a group.
There is a disparity in how effective community projects are and how they are represented in decisions for governmental funding. These are great examples of how the work of people in the community have provided better and more accessible care for people with mental ill health, be it providing a support network and structure like Theatre Nemo, or more effective care for a person in crisis like that of Rosie Wright and her team.
All in all, what we're finding more than halfway through the pilot is that officers are finding that they're delivering a far better service to individuals in distress, and individuals themselves are getting a far more caring, professional, joined up response to their whatever the situation is they're finding themselves in. It's making them contact the police in the first place.
Yeah, I mean, if I had the means, if somebody said, well, you know, Theatre Nemo is there, you can refer, I would refer patients directly. It would be another route for me to go. The difficulty for the GP is we don't have that resource. We don't have it. It's not there.
There is lots of groups doing fantastic work, but again, there's not enough. There's not enough resources put in place for people to do the work. There's not enough support in place for the people to do the work. And every creative, third sector, charity, whatever you like to call it, everybody is struggling to survive.
I'd love for more people to get involved in smaller projects like this, or organisations that do more in the community.
Some of the funniest comedians have got some of the darkest histories, and I think that's why they use that to cope, and I think that's how it creates people like that. We actually came up with a theory a few weeks ago. It was actually me that came up with it, about how people that have suffered mental illness or anything adds more of a, how would you say it, more dimension to the person. I don't know if that's true or not, but it's...
Whilst the government acknowledges more needs to be done for the mental health care we can offer in Britain, I wonder if they are truly considering how. Instead of blaming existing services that are overstretched and underfunded, they could promote and support underrepresented community services like the ones explored here. Mental health is not something to hide from. It is not something to be seen as only something to treat. We should acknowledge and embrace the wide spectrum that exists in mental health, as we do physical health, and we should ensure that amongst services aimed to treat an illness, there are services aimed to support a different way of being in the world than just happy.